Cutting and bone removal is something that we just don't do anymore. We choose something that's called LANAP. It's laser surgery or laser treatment. And basically what happens there is that this laser fiber goes around each one of the teeth and removes all of the diseased tissue. So we have a pocket that has diseased tissue, and with the fiber, all of that diseased tissue is removed, so that what's in the pocket afterwards is healthy tissue. We also do very effective cleaning at the time that we do the surgery, so now the healthy tissue has a tendency to want to reattach to the tooth.
The two people that I believe fit into the category of great laser candidates are people that have gone through a good periodontal program and still have infection left in their mouth. So anybody with pockets and bleeding and gum infection that haven't been able to be made healthy by perioscopy type of cleanings, they're great candidates. The other candidates that are great for laser therapy are people that have periodontal disease in the front of the mouth. Because of this laser gets you healthy by making the bone grow up to the gums as opposed to the gums shrinking, we don't get the same aesthetic and sensitivity results we get from doing cleaning. So if patients come in that have periodontal disease in the front of the mouth, this instrument and device and technique is far superior to any other technique we have.
The dental laser kills bacteria that not only are attached to the root surfaces, but actually live in the gum tissue. So while we may get your roots very clean, if the bacteria penetrates into the gum tissue, that bacteria can repopulate onto the root surfaces and cause periodontal disease to progress. But with the use of a laser, that laser can penetrate through the gum tissue and kill all the bacteria.
Nowadays when we're doing our laser, our LANAP therapy, that therapy takes about 20 minutes per area. There's no rotary instruments, so there's not debris flying around, and the pain is managed almost always exclusively by anti-inflammatories like Advil and medications like that. We do prescribe the narcotics, and most of the time the patients come back saying, what do I do with these pills now? Because they didn't even use them at all or just one or two. And they return to work in a couple days. It's very quick recovery. Even the next day or the day after that, they're back into their normal life. And because we solve their gum problems by growing back tissues and not getting gum receding, there is no sensitivity. So the surgeries are easier, there's no cutting and sewing, there's not any bleeding issues, there's no significant discomfort at all or any sensitivity. So we get a better result than we could have ever gotten, and the patients find it to be a much more tolerable procedure.
Because of the decreased time that's necessary to perform LANAP therapy, and because we're not using any bone grafts, it's actually less expensive to treat periodontal disease with a laser than it is with conventional means.
I understand that we are the only periodontists in the greater Seattle area that are certified with the particular laser that we use. One of the great things about this laser therapy, LANAP, is that it's relatively pain-free. I do have patients that have a little bit of discomfort for a day or two afterwards, but then it's as if the procedure wasn't ever done. Patients are absolutely thrilled with this, and if the patients are thrilled, I'm thrilled.